Thank you, Ms. Bean. And again, I would like to thank all of the people for coming out here. I'd like to thank all the people for sending their thoughtful emails. This is what good government is about having open conversations about new ideas. So again, I thank you for everybody that participated in this. I think we need to make a couple of clarifications first. The reason that this issue is being addressed now is that the county has begun the open bid procurement process for the county health care plan. This process typically happens only every 4 years. So let it be clear that the timing of this issue is directly correlated to the timing of the procurement process and not to my election. Knowing from research the social and economic advantages of extending health care benefits to employees who are in long-term committed relationships, whether they be same-gender or opposite-gender couples, I made a request to our county administrator, Ms. Bean, and to our Director of Human Resources, Ms. Swanson, to include domestic partners in the request for proposals from prospective insurers, and that they direct staff to begin a due diligence study to determine the feasibility of extending such benefits and the financial impact that it would have on the county's budget. I was advised that this would not be possible since the board had passed a directive on April 7, 2004 that forbade the staff from studying, researching, or even considering the matter. I was advised that the only way this issue could be revisited would be for the board to rescind the directive made in 2004. Which brings us to the conversation that we are about to have today. Today, we will not determine whether or not to extend equal health care benefits to all of our employees, but whether we as leaders and the people of this community will have the vision and courage to open our minds and step out of our comfort zone to allow meaningful conversation about a new concept that could have a significant positive impact on our community for generations to come. Or whether we will close our minds and shrink to our regressive decisions of the past and once again shut the door on the opportunity to bring progress to our community. That is the decision that we will make today. Whenever discussing our employee benefits, I think it's important that we thank and recognize all of our employees that have dedicated their lives to serving the citizens of our community. I value each and every one of our employees, and I'm grateful every day for the service that they provide to the people of Hillsborough County. As valued employees, one of the greatest benefits that we could ever offer to our employees is access to affordable, quality health care. Currently, the county offers health care benefits to single employees and spouses and children of employees, but not to unmarried partners, whether the same or opposite gender partners who are in long-term committed relationships. At a time when most Americans are experiencing financial hardship, providing equal pay for equal work and having access to quality and affordable health care is essential. My partner and I are blessed to have excellent individual health care coverage and would not need to apply for these domestic partnership benefits at this time. But this may not be the case for some of our other employees. I'd like to review some of the facts that I have found while researching the issue of domestic partnership benefits. According to the 2005 American Community Survey from the U.S. Census Bureau, there are 31,195 unmarried partners residing in Hillsborough County. At least 49 public employers across Florida, including Alachua, Broward, Miami-Dade, Monroe, and Palm Beach County, the City of Tampa, the Pinellas County Sheriff's Office, and the University of Florida, to name just a few, extend health care benefits to domestic partners. I have provided all of you with a complete listing for the record, and this is also available to the media as well and anybody else that's interested in looking at these figures. A majority of Fortune 500 companies and 80% of Fortune 10 companies offer health care benefits for domestic partners. Enrollment figures for organizations extending health care coverage to domestic partners range between 1% and 2%. 67% of couples electing domestic partner coverage are opposite gender couples. The actual cost of covering a domestic partner is less than for covering a married spouse. However, more important than statistics in these trying economic times, I believe that it's essential that all of our valued employees, again, have access to affordable, quality health care. In addition to the obvious benefits that our employees realize from inclusive health care benefits, there are also economic benefits for our community. Commissioners, I believe that we are all on the same page when it comes to the desire to attract companies and industries that offer higher paying jobs to our community. I would urge each of you to read and study Richard Florida's The Creative Class. In his work, Mr. Florida discusses that a key factor when determining whether to relocate is the inclusiveness and diversity of a community. Company leaders want to know that all of their employees are made to feel welcome and included in any community they're considering. We all know that Hillsborough County has a world-renowned reputation of being a less than inclusive community. It is not because we do not live in a diverse and inclusive community, but rather because we are indeed a county rich in diversity. It is because the exclusive and divisive legislation passed by some of our past political predecessors that have unfairly earned us this reputation. From past policies of racial segregation to the most recent policies of banning books from our public libraries, our county's image and reputation has been unjustly tarnished, and as a result, the economy of our county has been forced to bear an unfair cross. Commissioners, we have the opportunity and the obligation to our citizens to begin changing our reputation. By making this small policy change, we will send a message to the world that we are evolving into a more inclusive community, and to prospective companies who may consider relocating here that we are open for business and ready to inclusively welcome you and your employees to our county. Now, I know that from the emails that I've received and the comments made this morning that many of you are concerned about the cost of extending these benefits, especially during these turbulent and economic times. I'm very sensitive to that, and that's why it is very important that we do our homework and due diligence to determine the financial impact that such benefits will have on our budget before we ever approve such a plan. I will caution you, however, that it is important that we not be penny wise and pound foolish. Research shows that two major contributing factors to the rising cost of health care are the uninsured and the underinsured. Individuals who do not have health insurance and need medical attention will use hospitals, emergency rooms as their health care plan. Here are some startling facts from the National Coalition on Health Care. Nearly 46 million Americans, or 18% of the population under the age of 65, were without health care in 2007, the latest government data which is available. Lack of insurance compromises the health of the uninsured because they receive less preventative care, are diagnosed at more advanced disease stages, and once diagnosed tend to receive less therapeutic care and have higher mortality rates than insured individuals. The United States spends nearly $100 billion per year to provide uninsured residents with health insurance, with health services, often for preventable disease or diseases that physicians could treat more efficiently with earlier diagnosis. The uninsured are 30 to 50% more likely to be hospitalized for an avoidable condition, with the average cost of an avoidable hospital stay estimated to be about $3,300. The increasing reliance of the uninsured on the emergency department has serious economic implications, since the cost of treating patients is higher in the emergency department than in other outpatient clinics and medical practices.